I want to start by congratulating Tom Brady on another Super Bowl championship and MVP award. I, like many people here in New England, I rooted for him all the way through the playoffs, and it couldn't happen to a guy who's done more for us than he did. And I think it's wonderful that once again people have had a chance to appreciate what we've known all along, which is he really is the GOAT. Now I'm here today with Lieutenant Governor Polito and with U.S. House and Ways and Means Chairman Richie Neal, who in many respects has been the GOAT for the Commonwealth of Massachusetts over the course of the past several years as we've worked our way through this pandemic. Time and time again, as we've been working through so many issues that were unanticipated and came with this virus, our office would reach out to his and engage in a conversation and a discussion about what we were worried about and how the federal government might be able to help us as a Commonwealth deal with the myriad of issues that came with this, the economic collapse, the PPE issues, the testing issues, the hospital and long-term care facility financial issues, so many things that came up, one after another, as we worked through the first 10 months of this very difficult ordeal. And I just want to start by saying that the chairman was never more than a phone call away. You never had to call him more than once if you wanted to talk to him about something that was important to the Commonwealth. And I know I speak for the Lieutenant Governor, for myself, and for everybody on our team when we say how much his organization, his office, and he in particular have meant to our efforts here in the Commonwealth of Mass. And we're pleased to be here today to talk about the need for the feds to continue to support state responses and state efforts to work through the pandemic and to prepare for and support the recovery that will desperately need to come after it. And before I get into a few more details on this, I do want to give a quick update on our COVID-19 data. Yesterday, the Department of Public Health reported 3,000 new COVID cases on 113,000 tests. Over 14.3 million tests have been reported in total here in the Commonwealth. 1,389 individuals are in the hospital being treated for COVID. That number, as you all know, is down dramatically since January 4th, which was the peak, and 318 are in the ICU. On vaccines, as of the end of the day Sunday, 859,118 doses have been administered, and over 1.25 million doses have been shipped to providers here in the Commonwealth. COVID-19 has impacted nearly every aspect of life and created substantial challenges for the state, for local government, and for all of us, both here in Massachusetts and across the country. Our economy and the jobs and the purpose that come with it have been significantly impacted by the pandemic. And we've worked hard over the course of the past 10 months to balance the needs of keeping our economy open safely while responding to the pandemic. But there are still substantial financial challenges that we face as a Commonwealth and that other states across the country are facing as well. And it would be critical from our point of view for Congress to pass significant relief swiftly to help us beat down the pandemic and, just as importantly, help get our economy back on track. Here in Massachusetts, our economy was powering forward last February, but COVID brought everything to a grinding halt. Through the work that was done by Lieutenant Governor Polito and others in our business community, we collaborated with public health experts to safely and carefully reopen our economy. And while hundreds of thousands of residents have returned to work over the past few months, there are still way too many people out of work through no fault of their own. The Commonwealth is still down 330,000 jobs from this time last year. We're now in a much better economic spot than we were last spring, but many of our residents are still unable to find a job, and our main streets are hurting, and many small businesses have not recovered from the pandemic and won't for months. Many of the jobs that are lost are going to be very difficult to bring back because they're in industries whose operations have been significantly challenged by the pandemic and will be in the months ahead, including the hospitality, indoor entertainment sectors, and many of the other folks who operate in businesses that were based on what I would describe as the benefit of the crowd. Our state finances are also feeling the burden of COVID-19. Tax revenues have fallen significantly since the start of the crisis, and they remain unpredictable. I think this past year was the first time the Commonwealth ever went 6 months before we in the legislature finally managed to figure out what we thought revenue would look like for the rest of this fiscal year and work together to pass a budget. But that recently released fiscal plan for fiscal 22, which we just filed, is built on a projection that is down $1 billion from the original prediction that we had for fiscal 21 at the start before the pandemic. Our expenditures have been focused on what we would describe as critical priorities: protecting public health, supporting hospitals, nursing facilities, and long-term care providers, obtaining and stockpiling and distributing PPE, promoting housing stability, encouraging economic development, and providing resources and support to local governments and local schools so that students can return to the classroom. This response has clearly been historic, but it has been very much supported by our colleagues at the federal level, including the work that was done by Chairman Neal and his team, and we appreciate their effort here in the Commonwealth. And with this funding, we managed to expand our testing and vaccine infrastructure, provide rental assistance for people who are facing evictions, and we had over $1 billion that flowed through the Commonwealth to local communities to support schools. We've also used this funding to provide over $56 million to address food insecurity, and the federal government has put significant resources into food insecurity over the course of the past year as well. And this is in addition to the billions of dollars the states received to help people dealing with unemployment. Another $38.5 billion has been provided directly to businesses, nonprofits, and individuals in the form of the Paycheck Protection Program loans, stimulus checks, and relief for providers and small businesses. We've also focused on supporting our partners at the local level, as we know they are facing similar difficulties and challenges. And as part of this, we allocated over $500 million in funding to cities and towns to support their own COVID-19 relief efforts, and we worked with the legislature throughout last year to keep our state budget balanced and working for the people of Massachusetts, and at the same time found paths forward to make resources available to small businesses operating one of the largest, if not the largest, small business grant programs in the country. We are very lucky that over the course of the past 5 years, our colleagues in the legislature worked with us to establish a very significant increase in our stabilization fund, which is basically, at the start of the pandemic, was 3 times the value it was when we took office. And the availability of those resources, along with federal support, have made it possible for us to look out for our neighbors, to deliver on our program commitments, and to continue to invest in many of the areas that were so important as we worked our way through this pandemic. And as cities and states ramp up their vaccination recovery efforts, support from D.C. will continue to be a critical part of how we get from here to there. The feds can play a huge role with respect to vaccinations, testing, school reopenings for both K through 12 and higher education, food insecurity, housing, rental, energy, and water assistance, small business support, and support for states, local governments, and territorial governments as they do the hard work that's going to be associated with trying to rebuild their economies and especially deal with the dramatic changes that have taken place with respect to how and where people work since this pandemic began. And I can't understate how big a challenge that is going to be for everybody as we move through this pandemic and on into the future. The final thing I'll talk about is the fact that while we are at a critical point in our fight against this pandemic and against this virus, it's more important than ever that there be a predictable path forward for states and for local governments as we work to do the things we are going to need to do to rebuild our economy, deal with the consequences of the pandemic on many of our downtowns, and to find a path forward to make sure that all of our people here in the Commonwealth of Massachusetts are able to weather the final few months of this as people get vaccinated, and more importantly, are able to find a way forward back into the workforce, hopefully, and back into the life that they used to have before this all began last March. And with that, I will turn it over to the chairman.
Thanks, Governor, and Lieutenant Governor Polito as well. I want to thank the Governor for providing the forum here today to talk about what the President's proposed assistance package will look like. It is certainly going to pass. The Speaker has made clear that this will pass, she believed, maybe in the second or third week of March. We met with the President on Friday for 2 hours to talk not just about the plan. They had outlined an architecture, and we have filled in the details. But in the case of Governor Baker and the Lieutenant Governor, I conferred with him regularly, sometimes on a daily basis, as we proceeded through the CARES Act and the HEROES Act, and then subsequently the $905 billion package that we passed in December. So the timeline, as I've just described it, is the one that we intend to adhere to. I'm going to run through some of the details that I know that are really important. The Ways and Means Committee has responsibility for tax, trade, tariff, Social Security, Medicare, pensions, management of the public debt, and welfare. Small working committee and enormous responsibility. So the President has proposed $1.9 trillion in spending. The Ways and Means Committee, beginning Wednesday morning at 10 o'clock and hopefully concluding on Friday, will write $941 billion of that responsibility. Part of it is what we call the use of tax expenditures to implement policy. Here's what the plan is going to look like. The blueprint will be for the public to inspect tonight beginning at 6 o'clock. We are not going to we will not get the economy back up and running until we defeat the virus. Last month's jobs report, as you all had a chance to witness on Friday, provided a new glimpse as to where we find ourselves. 47,000 jobs created. 10 million jobs that were lost in the pandemic have not been returned. 19 million Americans are receiving unemployment insurance. Our hospitals across the country, in many instances, are under siege. Labor participation rates, which people like me pay a great deal of attention to, are there for all to witness as we try to find our way to recovery. We wrote the CARES Act. It saved the American economy. Economists left, right, and center would all agree with what I've just asserted. People are struggling. We need to hear their calls for help. Right now, when you look at the American economy, it highlights the changes that have taken place, not just because of technology, but the idea that people in the middle and upper middle classes in high income groups have all held their own through this. But people in the lower end of the middle class and lower end of the economic spectrum, they have really struggled. 10,400 businesses in Western Massachusetts took advantage of the Paycheck Protection Program. 10,400 businesses took advantage of it. Perhaps the most important thing we did, and we're going to do it again in this package, was unemployment insurance. That was essential. Many people, through no fault of their own, found themselves outside of the economic mainstream. The economic impact statements, which we intend to do again, means that we are going to make good on our promise of $2,000 checks, supplementing those based on what we did back in December with an additional $1,400. For low-income families, we plan to help them with the most basic necessities of what we might call liquidity and cash flow, meaning that additional funding to existing programs that will provide this emergency cash or cash-like assistance, as I intend to do with the Earned Income Tax Credit and advancing the child credit, which is an extraordinary advance on what we intend to do with child poverty in America, which, as the OECD has indicated, lags behind the rest of the world in our efforts. We want to make it easier for the unemployed to afford their health insurance through premium subsidies. We're going to expand opportunities for COBRA. We're going to provide an enhanced premium tax credit for those receiving forms of unemployment insurance that will reduce their out-of-pocket costs. We plan to assist the most vulnerable who typically aren't offered health insurance through extending opportunities for them as well. The unemployment insurance supplement will also be embraced once again, between $300 and $400 additionally each week. Lastly, we plan to shore up the multi-employer pension plans, which is a big issue right here in the city of Boston as it relates to Local 25. And we intend to make them solvent. They did nothing wrong. It was not about economic malfeasance. It was not about corruption. It was about changes in the marketplace. So specifically, again, our plan is to provide elderly assistance through a strike force for $250 million. Massachusetts, through the governor's leadership, already took advantage of $2 million of that last time around. We intend to expand it. The Elder Justice Act, which will also provide an additional $250 million to support elder abuse, will be received as well. Supporting health care coverage and improved affordability, there will be some requirements that the Massachusetts Connector will have to make some changes, but the governor is, in my judgment, he's had that down pat from day one. My staff is helping to provide and include dedicated funding for state-based exchanges to offset the cost of changes that will take place in technology as well. Special ACA marketplace insurance subsidies will be also there to accompany unemployment insurance, and specifically 6 months of COBRA subsidies from April to September of 2021. Working families, the direct payment, as I noted, will be there. We intend to create a national vaccination program and speed up the distribution. I believe 35 million Americans have been vaccinated, and last Thursday we hit the first day of 2 million vaccinations in one day. We provide expanded testing and contract tracing programs across the country, and $130 billion for schools to be reopening. Everybody sees that as a clear priority. We strengthen nutrition programs. We provide funding for rental assistance, extending the eviction and foreclosure moratorium, more funding for child care, and, as I noted earlier, economic relief to families by making the child tax credit refundable. COBRA, Medicaid, I know that what this has done to the states. I know what the Medicaid budget does in states across the country. It's pretty universal in terms of the challenge. It's the fastest growth portion, I assume, of the state of Massachusetts budget. And we believe the $360 billion that is going to come to our states through formula will take some of the pressure off of that challenge as well. Small businesses, we intend to revisit again through the Paycheck Protection Program. And one of my favorite initiatives, I hope that we are going to include as well, is the Retention Job Tax Credit, which worked very well. So that's a pretty good synopsis of what we intend to do. Whenever the governor is ready, I'm happy to take some questions. Again, our timeline is tight. The president was fully engaged on these matters on Friday morning. 2 hours we went back and forth with him on filling in the details as I've described them. And the Speaker has made it clear that this is going to be done by mid-March, when unemployment benefits expire, I think March 14th. So we want the package ready to go. Just the last couple of comments, and that's important to remember. The CARES Act was done in March. We came back and we did what was known as the HEROES Act. The HEROES Act was met with some resistance in the Senate, the result of which is unemployment benefits expired for some Americans, but the lag time between May and December, when we passed the next package, I think contributed to the economic slowdown, which we're now witnessing. We're seeing the evidence of it right now. So our plan here is to do these initiatives for at least 1 year, try to buy some time to find out where the pandemic leaves us. The pandemic is now a year old. And a lot of people in the American family are hurting, and we think that this assistance in the timeline that I've laid out is entirely reasonable. We do not go down this road without seeking a lot of input from a lot of different people. Janet Yellen and I have talked extensively. She helped me develop the CARES Act. I think that's a fair statement. And in addition, we have sought advice across the spectrum from people as to how best to proceed, including an individual who's been very helpful as well, Jay Powell, Chairman of the Federal Reserve Board, who has said, go big. We intend to go big. Yep.
How soon people will, if this passes on the timeline that you described, how soon will people feel the impact and see the
April 1st. One of the things that we've also discovered here as we put together this initiative, that again, it's the enhanced role that technology plays everywhere. So we were able to get this money into a lot of those electronic outlets with direct deposit in a matter of hours. It was really astounding, and it also simultaneously helped to create demand. You know, it's not just about liquidity, it's about creating demand for people who need that sustenance every single day. So I think that you could safely write that just about April 1st they would see this, maybe a bit sooner if we get the package done and signed, but I expect that to occur, and those unemployment benefits are a lifeline for millions and millions of Americans.
Representative, how long, so you already spent this money, how long do you think it will take for us to make a recovery? I mean, it took us a year to get here. And then also, what will the national vaccine program look like?
Well, let me say this again, and this is not a partisan statement by any stretch of the imagination. I think we've learned a hard lesson about making sure that there was a federal effort in terms of the response, a national response. And saying to the 50 states, you're going to do the fill-in, did not work the way that we intend it to work now. We want to be full partners with Governor Baker and Lieutenant Governor Polito to make sure that this, in fact, is a national response. And what was the second part of your question?
The vaccine program, what would that look like different from how we're doing it now?
Well, I think the idea is just to get it out more quickly. And if I can, just in a parochial sense, I also thought one of the most amazing things that's happened here is these home-based companies in Massachusetts. What they did in 10 months, which usually takes 4 to 5 years. I mean, we're reminded of the role they play every day in our lives. So I think that the president's plan is pretty ambitious. He has said that by summer, he wants, I believe, almost 300 million people to have been vaccinated. And he's ramping that up even as we speak. I was listening to a newscast as I came in this morning.
Would that be a connection to the federal government?
Yeah, we want to provide the resources and the dollars that are so important.
Mr. Chairman, how important is bipartisan buy-in on this in the House?
I had a feeling that would come up.
With two Republicans,
Yeah.
Are you asking them to maybe contact your colleagues?
So let me give you an example of some of the things that we did last year, my first 2 years. We passed the largest trade agreement in the history of the world with redoing NAFTA. Every Republican on my committee voted with my position on it. We passed the most important advance in retirement savings in 15 years. Every Republican on the committee voted for my bill. And on surprise billing, which is a big Massachusetts issue. The governor talked to me about that right after it passed. Every Republican on my committee and every Democrat voted for it. I had one Democrat who didn't vote with me on the 3 issues I've just outlined. That was it. Everything else was unanimous. I want that support and that help. We did that with the CARES Act, and we did it with the package in December. Here's the challenge. The process of reconciliation, it's arcane by procedure. Both sides have used it, and I understand that you would much prefer, as the Speaker noted and the President noted on Friday, to do this in a bipartisan manner, but speed is of the essence. So we are still open to suggestions, even as the documents are unfurled, for input. I thought that there's room here just based on some of the comments I've made earlier, and I think it would be very helpful for them to fully participate. I think when you look at the polling data on our proposal, it's pretty wild where it comes down. 3/4 of the American people support what we're about to try to do, and in fact, what we're going to do. So would we prefer bipartisanship? Yes. And do I know Joe Biden? I have. And we're going back to bipartisanship because the next piece of legislation up, as soon as this passes, he said again Friday morning, we are going to infrastructure. And the Ways and Means Committee will handle the finance side of the infrastructure initiative. Reconciliation leaves some wound. I mean, some sore spots. The difficulty we have is that you could also see that endless rounds of negotiation and then not having a durable outcome can also defeat the purpose. And there's some evidence that that happened with a couple of initiatives that we've had. And they used it, by the way, for their tax package in 2017. They used reconciliation. And there was not the threat of a pandemic or an international health issue. They used it. So both sides have used it over the years. We would all prefer a bipartisan path forward. Legislation changes lives. That's why I would prefer it.
Congressman, there is some debate, as you know, regarding the income threshold that's been discussed.
I've noticed that.
And, I was wondering for high-cost states, even 60,000 or people who make a little more than 65,000, should that be too much to qualify for?
That came up on Friday at the meeting, and then the press conference that we had outside with the speaker outside of the White House. I handled that. So what we did in the CARES Act, which I thought was reasonable, we used the ceiling of $150,000 for joint filers and $75,000 for single filers. This time around, we're going to expand that to dependent children. The president has indicated he's open to some negotiating on the ceilings, but this time around, dependent children are going to be included, and that would, I hope, include in the final package college-age children as well, for sure. So the point that you raise is entirely legitimate about that income-based guidelines. But here's the other thing that was noteworthy, and I hope that this might be something that you would draw some attention to. One of the problems we had in getting that money out the door with the CARES Act, the millions of Americans as joint filers who make under $24,000 a year and single filers who make under $12,000 a year, people that live two incomes under $24,000 a year and then single income under 12, they don't file taxes. They don't have tax ID numbers. So we tried valiantly. We went back and traced Medicaid records to get the checks to them. That's what the delay was about, in getting a lot of those checks out the door. So your point's on target, and I think that we want to make sure that joint filers at $300,000 are not getting the check. So we could, I think, include a phase out, which we intend to do with the child credit and the earned income tax credit. We will use phase out. And when you look at the distribution tables, that's something that I think that we can accommodate.
Congressman, how do you expect families to be able to navigate the child tax credit? What kind of benefits will they get from this?
So I think my proposal is that for children under 6, it would be $3,600 a year per child. 6 to 17, it would be $3,000 a year per child on a refundable basis. So administration of the initiative is going to be a bit of a challenge for the Internal Revenue Service, which we oversee, and the Treasury Department, which we oversee. I have raised the issue with Secretary Yellen. What we want to do is change it from people trying to derive the benefit during the tax filing season. We want it for cash flow purposes to be done on a monthly allocation. So Treasury would just issue a check for $300 a month, for example, to the eligible income families. And I think that would provide greater liquidity, assurance, and, as I said earlier, simultaneously create demand. I'm not naive about how that will be implemented. So investing some money in technology for IRS and Treasury to get that done is huge. I want to tell you this. The reason that story appeared in the Post yesterday, we wanted to remind people of where we rank in the world with child poverty. And I know the governor and the lieutenant governor, they're very sensitive to that issue. We've talked about it. In trying to do something with some immediacy to it, Governor Romney proposed essentially the same thing that I proposed, after I proposed it, by the way. But the difference is he would cut the nutrition programs to pay for it. So we're saying, let's do this for a year and see what the outcome is. But I can tell you this, if we can get this done, which we will, in the next 4 weeks, we're likely to make this a permanent feature of what is known as tax expenditures, policy implemented through the tax system. I'm all in.
Congressman, can you address Republicans' concerns that the deal would cause runaway inflation? And can you predict what state this bill will be more?
Yeah. So I follow this stuff maniacally and have for years and years and years. I mean, labor participation rates, follow the Fed almost on a daily basis, follow really good economists who talk about this. And interest rates are where they are, and they're going to stay that way for the foreseeable future. Jay Powell has made that pretty clear. Janet Yellen said our concentration here ought to be on full employment. And we can address through fiscal policy and or monetary policy those challenges down the road. I don't see them at the moment raising their heads. It's kind of noteworthy that the Federal Reserve Board would like to see inflation get up to 2%. Pretty extraordinary. And so we've all gone through what is known as counter-cyclical legislation, these automatic game changers that used to be included or wanted to be included in the budgets. That didn't happen the way we were able to foresee. But inflation, I can give you the names: Paul Volcker, Alan Greenspan, Arthur Burns. I mean, and now Janet Yellen, who I think was a superb appointment, a mainstream thinker. And I applauded that appointment, long history at the Fed, chief economic advisor to former president. So I'm going to go by the advice that Jay Powell and Janet Yellen are offering, a Republican and a Democrat. Yeah, good question. I mean, there was a time when we could really have these lengthy conversations, as you know, and worthwhile conversations. The challenge we have today, if you don't speak in incomplete sentences and talk about things that go online in 10 seconds, it's hard to have these conversations, and both sides employ the same tactics. So I am going to come down on the side of full employment.
Congressman, has there been any update on ways to address racial inequities in when it comes to the Paycheck Protection Program and other federal programs that may have gone to majority white-owned businesses as opposed to minority or veteran-owned businesses?
I think that part of that conversation is the whole idea of the Paycheck Protection Program and economic inequities. I would get for you, before you leave us, two women in the back there, the Ways and Means Committee just put out a comprehensive document that reinforces what you've just said, and how to better use perhaps automatic stabilizers to make sure that those businesses that need it through this pandemic get the bridge and the lifeline they need with a more sturdy response from the government afterwards. But when you see this report from the committee staff, and I wanted to say this about the Ways and Means Committee, they make me look good every day. They'd be the envy of any academic institution, any business, any think tank. They're the best on Capitol Hill. And they put together this documentation, as I've just outlined for you, and I'm surprised it hasn't received more attention. With the think tanks, it really has. So it's interesting that on my proposal with the child credit, that Governor Romney wants to get it to the same corner of the room, and I want to get to the same corner of the room. We just got to figure out how to get there. But I think our plan will hold.
Can you give us an example of some of the findings or recommendations in there, just for the, so the business?
Yeah, one of the biggest recommendations is getting children earlier access to health care. Really important consideration. Making sure that there's more entrepreneurial opportunities for people who are outside of the economic mainstream. Now, I always do this in Washington with great pride. We built a model here in Massachusetts on health care, not without some bumps and setbacks and all, but health care is tough. It's tough because trying to predict outcomes is really hard. And conventional economics don't work in health care. That's the reality. But 100% of the children in Massachusetts right now are covered. Pretty extraordinary. Our argument ought to be to advance that so that they can depend upon even better health care going forward. And that's why there's more money in here for neighborhood health centers as well. Good point. Thank you. And I will get that report to you because it's that good.
Chairman, as far as vaccine distribution, how do you feel the federal government has performed through a few months getting vaccines to states?
I thought we were a little slow on the draw. And I think part of it was the kind of the chaotic nature of political people trying to answer science questions. I learned a long time ago not to trespass. Augment, but don't trespass. I mean, I really think Tony Fauci's a pretty capable guy. I think Mark Kerouac, who runs Bay State Medical Center, he's an infectious disease doctor. He's a pretty capable guy. And I don't think that you should let politics get in the way of the science. So you had this advice that was coming from the medical people, of which we have the best institutions in the world, arguably, here in Massachusetts. And our response here, I thought, in the state, we've been trying to get it done right, but every time there was this sort of chaotic Washington response, it wasn't helpful. And I don't want to get into, I don't think this is a moment for partisanship, so I think that when Tony Fauci said you ought to do the following, X, Y, and Z, we should have done X, Y, and Z. And I don't think there's anything in my background that would cause me to question Fauci's understanding of what was necessary and sticking with that position. I just want to say this as well, because I'm glad you raised it. So I was in Southbridge, Massachusetts, a week and a half ago, Harrington Hospital. They're about to affiliate with, and the Lieutenant Governor would know that from the central part of the state, they're about to affiliate with UMass Medical. A spectacular little community hospital. They had vaccinated 4,500 people in this little town. I think the town has about 13,000 people. And Ed Moore, who runs the hospital, he said, would you come out and take a look at this? I want you to see it. So I went out to see it. Pretty interesting story. How some parts of it they were able to get it done because of that head-down approach, and it worked pretty well. So I think the federal government bears some responsibilities, particularly in the executive, for not getting that done. And I think the states have been constantly trying to catch up to it.
And in your own district, how do you think vaccination's going in Western Mass?
Well, I mean, look, I'm a big fan of Berkshire Medical Center. Bay State, all 12,000 employees, new wing being planned. I mean, I often think that even those of us in Massachusetts, we sometimes take the health care that we have for granted. The best hospitals in the world that employ tens of thousands of people. And the other point of it that I would make, not to give you a doctoral dissertation, but I remind people of all the time, every one of these hospitals is at least 50% dependent on Medicare reimbursements. Take another 15 to 20% for Medicaid, or go to the Sisters of Providence in Springfield, they're 90% dependent. Holyoke, 90% dependent on Medicare and Medicaid. Private insurance plays a very, very small role in those hospitals. Here, there's a larger capacity in the city of Boston, but I hear from these hospitals all the time on those wage index issues, because we're going to make sure they continue to be the best in the world. And that's not a Republican or Democratic issue. That's just a good, sound policy. But as the governor nodded, I could tell right away when I mentioned Medicaid, it's always a challenge. It's always a challenge. And sometimes the growth taxes don't accompany Medicaid costs. Yes?
What do you think is missing in the vaccine distribution right now? I mean, besides the money that they need to do with vaccine.
Well, I think money's been a big part of it, and I think now just greater coordination between the federal government helping out the states, I think that's going to be part of it. But I think that's a pretty sizable challenge that the president has offered, to say 300 million people will be vaccinated, and I think we reached 70% herd immunity. He has suggested by mid to late summer.
What will we see differently to make that happen?
Well, I think a lot of it's going to be resources and determination. I think those are the biggest things. I mean, he's got a lot riding on it when he put out that sort of a challenge to the American people. And I think that we're fully up to it.
Just back to the stimulus bill, on those figures that you laid out earlier, is there any room for negotiation to maybe pick up some of that bipartisan support that you discussed?
The president's made it clear he's not coming off of $1.9 trillion, and I agree with him. This is about a pandemic. This is about stability. I often hear people say stimulus. This is about stability. Stimulus will come with the infrastructure program. But right now it's about stabilizing people that can't pay their rents, can't make their mortgage payments. And look, there's some good news tucked into it. The national savings rate. I was thinking of that just by myself a couple of days ago. And I was thinking that some of you have some gray in your hair, you might remember this. When the Japanese purchased Rockefeller Center, people thought, oh my God, this direct foreign investment, this is going to be bad for the country. You know what the national savings rate was when they did that? 2%, 3%. The national savings rate now is at almost 14%, $16 trillion. So people are looking to the rainy day, but they need more help to get over the goal line. And I think that's the reason that if we get this right, to a couple of your questions, in the next 3-4 months, the economy's poised in the third and fourth quarter to really take off. But that, not to negate the idea, that was a bad jobs report last Friday.
What do you think of Ben Downey running for governor?
His first job was in my office. There's a number of state legislators that started in my office. I don't know if I take credit for that or not, but he's a nice guy, nice family, and they've had a lot of influence in the Berkshires for a long time. I knew his father. I've known his uncles and the family up there. So he's just a very nice guy, yeah. Good.
Governor, question about the vaccine rollout. As you know, there have been a couple of bills that offer suggestions. I was wondering if there was any that stuck out to you. And additionally, there's one specifically on vaccine equity. I was wondering how you would say equity has played a role in your vaccine distribution plan and what role you want to see it play in the future.
Well, I think the biggest thing coming out of the gate was putting together a group that represented a pretty broad cross-section of points of view and opinions, including one who spoke here, two of them who spoke here. One was Reverend Liz Walker, and the other one was Mike Curry, who runs the Mass League of Community Health Centers. The community health centers are a critical part of how we believe we get folks into the game, especially folks who are hesitant, primarily because of their historic role in those communities as a trusted source of guidance, advice, and healthcare services. And I think in many ways, they have, in some ways, the best role with respect to helping us move this forward. We'll also get a lot of help from some of our folks in the provider community who we have urged to make sure they offer vaccines in what I would describe as some of the communities that have been most hard hit by this. And obviously the campaign we started last week will be something we'll continue to build on. But I think this is a really important issue. We've got to make sure that everybody in Massachusetts not only has access to the vaccine, but believes it will be the right thing for them to do. And I do think a lot of people, based on all the polling we've seen, there's a big community that's falling into what I call the wait and see category. There are very few people in the I don't ever want to take it category. But we're going to have to help see if we can figure out through either working with trusted partners in the community or messaging with trusted partners, see if we can encourage folks to go ahead and get vaccinated.
Have you given more thought to mobile units or some of the other things that...
Say again?
Have you given more thought to mobile units or some of those suggestions that have been proposed as ways to increase equity geographically, as well as in some corners where people might not have easy access to get to a vaccination site?
Well, part of the idea in places where there's a lot of geography has been these regional collaboratives. Berkshire County, which is out the Congressman's way, has the largest percentage of people in Massachusetts who've been vaccinated, working it through that regional collaborative. There's a regional collaborative in Worcester County, which the Lieutenant Governor was involved in setting up, which includes Harrington Hospital as the primary driver in South Worcester County. Haywood Hospital is the big driver in North Worcester County. There's a regional collaborative in Barnstable County, again, for the same reason, big geography, want to make sure that people who actually know those places well are the ones who are going to drive the policy and the outreach.
Governor, thousands of appointments would be available at Gillette Stadium, over 4,000, Springfield 3,000 later this week. Has there been any consideration to just moving forward to people 65 and over? And also I wanted to ask you about whether or not more of the vaccine should be redirected to some of those smaller sites from the mass site.
So the mass sites are batting about 100% in terms of vaccine allocated and vaccine administered. And they'll continue to operate at that level. And I remember standing here last Thursday or Friday, it's probably Friday, and saying there were 20,000 available doses left, and now we're down to a few thousand. And the few thousand that are available are toward the later part of the week. Not everybody makes a decision to do this 5 days out, 7 days out. Some people make a decision to do it 2 or 3 days out. But the best part about the mass vaccination sites is they're very efficient. I've toured 3 of them. The Lieutenant Governor's toured 3 of them. They're efficient. They're effective. People come out of it very happy with the experience. And the best part of all is they are pretty much dosing at exactly the level they're actually getting vaccine, which makes them the best player we have in terms of percent made available and percent administered in Massachusetts.
When do you think you might move to the 65 and over? A lot of people wondering about that.
Well, I think we'll move beyond where we are now when we feel like we've done as much as we can do to get the folks who are part of the communities that are currently eligible vaccinated. I mean, there are 430,000 people over the age of 75 in Massachusetts. We probably vaccinated somewhere in the 200,000 neighborhood the last 5 or 6 days. That's a big number, but I think we'll probably want to leave it open for a little while longer to see if some more 75-year-old folks sign up.
Governor,
Neal, you had talked about working with some companies. I think it worked very early on in the distribution. When do you think that would start coming into play, like a Gillette or something like not Gillette? Stadium.
Not Gillette the stadium, Gillette the company? Yeah. I would say that I think for us, the important thing here is to get as many of the 75-year-olds who are eligible vaccinated as possible, as many of the PCAs and home health care workers vaccinated as possible, get as many of the folks who are in the categories, the folks with developmental disabilities and the people who take care of them, the folks with mental health issues and the people who take care of them, the folks who work in homeless shelters and the people they take care of. The federal program on the pharmacy piece is now moving into assisted living facilities and senior housing, really key areas where it's very important that we make sure we get those folks vaccinated and get them vaccinated early in the process. I would say that we'll move when we get to the point where we think we've done a pretty good job with the communities that are currently eligible, and then we'll move. But I want to make sure we give these communities, part of the reason these communities were early was because they're vulnerable and at risk, and especially with some of the older folks, we need to give them a little room here to get there.
Governor, 2 lawmakers sent you a letter asking about the software developers website that I asked you about on Friday, telling you to take a look, consider implementing the functionality. I'm wondering, have you taken a look, and are you considering more improvements to this website?
Yes, we have taken a look, and we have reached out, and we expect that sometime this week we'll talk to her. It's, yeah, the answer is yes.
So improvements to the website will be coming in some form?
Yeah.
Do you have anything on UMass Amherst? That seemed like a big issue there.
I don't know exactly how they ended up in the situation they ended up in. It seems like it's primarily focused on the freshman class. I think the decision that the campus made, which was to basically put kind of the equivalent of a stay-in-place order in place to get through the next 10 days to 2 weeks, is not an unusual way for an organization like that to. They're not the first campus in Massachusetts, let's put it this way, to use that as a strategy to reduce the amount of spread they're dealing with. Several others have done that previously, and it worked pretty well.
Surprised though with it being a state school.
I don't know enough about the details there to know exactly what transpired. I just do know that it was primarily freshmen, and as I've said many times, the challenge we all have with this virus is, depending upon where you are in the age quartiles, your sensibility about how dangerous it is varies a bit. I mean, I don't know a lot of really old people, of which I am getting very close to being in that category, who don't think this thing can be really dangerous. That said, as the parent of 3 kids in their 20s, I know how a lot of kids in their 20s think about this, which is really different. And I think that creates a challenge for colleges. It's one of the reasons why we set up the testing program that we set up for colleges and universities with the Broad. And that was very effective at helping students understand the importance of this. I mean, there's nothing like knowing every single week you're going to get tested to determine if you're positive or not, and that will have some consequence with respect to where you can go and what you can do to encourage kids to do what we might call the right thing on this stuff. But, I've also stood here and said, this thing moves fast if you get it an opportunity. And pretty clear here, it did move fast. And I think what UMass Amherst is doing is a response that's very consistent with what other schools have done when they've been in the same place.
Has the hotline been successful? I know it's only been a few days, but the call-in line?
I would describe the performance of the hotline so far as, it's very successful. A lot of people have called it, and a lot of people got appointments as a result, which is exactly what it was intended to do. I think the biggest challenge we're going to have here, and it depends a little bit on what happens with J&J, for example, is, as the federal government provides visibility into what's coming in the pipeline, and as hopefully that number, based on the president's expectations about what he wants to see happen over the next few months, as that number goes up, we got to make sure that we have the capacity available in Massachusetts to go there, and to go there as quickly as the feds go, and to make sure that the experience for people is one that encourages them to talk to other people about it, to encourage them to do it. The big thing we want to do here is to get as many people as we possibly can vaccinated as quickly as we possibly can. And for some people, they're going to show up. I've said this before. There's a whole bunch of first movers out there. There's a whole bunch of fast followers. And then there's a lot of people who fall into that wait and see category. And we got to make sure we get them all and come up with either the messaging or the programming that makes it possible for everybody to think this is something that they not only should do, but that they want to do, so that we get everybody vaccinated as quickly as possible.
Governor, does the administration have any flexibility for those appointments that remain open and available in terms of letting people go ahead and take those who are not 75?
I think the goal here is to make sure that every appointment we have that's available is taken by somebody who's eligible. And if there are open slots at certain places, those vaccines are going to go somewhere else. But the mass vac sites are basically batting almost 100% in terms of doses delivered and doses administered. They are by far the most successful performer we have in our vaccine delivery system right now in Massachusetts.
Is there an amount of time?
Pardon me?
Is there an amount of time that you would give that? Like they don't get filled in a certain amount of days, would you then do the vaccine?
Well, the thing to remember here is they have the ability, more than most, to scale up or scale down pretty quickly based on what their appointment schedule looks like. That's different than in many cases the way a lot of the other folks operate. The long-term care piece, which is working its way through assisted living facilities and senior housing, they got a distribution directly from the federal government. That distribution was not just in Massachusetts, but in many states, a lot bigger than it needed to be. It was based on 100% census in the skilled nursing facility industry and a staffing ratio that, just call it high. And we were able, along with a number of other states and help from some folks in Congress, to get the feds to let us take some of the doses that had been going through that system and redistribute them back into the community so that they could be used in places where you'd get a higher administration rate. But I think over time, as the feds accelerate the amount of vaccine that's available to states, it's going to be incumbent on all of us to make sure that people have places to go and want to get vaccinated. Thanks, everybody. And thanks again, Congressman, for being with us.
Do you have an update on the number of appointments available?
Say again?
Do you have an update on the number of appointments you expect to be available? Any change from what you said?
Same number, exactly the same number. 101 something or other, 101,643 or something. Same number. Thanks.